Hello, this lecture about the nutritional disease. So the objectives of this lecture are recognizing main characteristic of nutrient-related disorders, and second, describing epidemiology of micronutrient deficiencies. Now, what is the nutritional disease? Nutritional disease involve any of the nutrient-related disease and conditions that cause illness in human. They may include deficiencies or excess in the diet and the nutrients, overweight and obesity, chronic disease such as cardiovascular disease, hypertension, cancer, and diabetes mellitus. Malnutrition refers to deficiencies, excess, or imbalance in a person's intake of energy and or nutrients. And it's classified into protein energy undernutrition, which involve wasting, low weight for height, stunting, low height for age, and underweight, low weight for age. Micronutrient related malnutrition, and this include micronutrient deficiencies, a lack of important vitamins and minerals, or micronutrient excess, and overweight, obesity, and diet-related non-communicable disease such as heart disease, stroke, diabetes, and some cancers. Undernutrition refers to insufficient intake of energy and nutrient to meet an individual's need to maintain good health. It involves both protein energy undernutrition and micronutrient deficiencies. What are the causes and the consequences of undernutrition? For the causes can be classified into three groups: the immediate causes, the underlying or intermediate causes, and the basic causes. And this figure shows the maternal and child undernutrition causes and the consequences. For causes of undernutrition and the immediate causes specifically include inadequate dietary intake such as inappropriate breastfeeding and complementary feeding, impaired absorption due to infection, disease, or inflammation, while for the underlying or intermediate causes it include household food insecurity, inadequate care or feeding practices, poor water, sanitation, and health services. And for the basic causes, the basic root cause of most undernutrition is poverty. This may be resulted from socio-cultural, economic, or political causes. It will affect access to adequate quantity and quality of resources, land, education, employment, income, and technology. For the consequences also can be classified into three types. First is short-term consequences, and B is long-term consequences, and C intergenerational consequences. For short-term consequences, included increase in morbidity and disability, and increase in mortality. For long-term consequences, included impairment of adult height, impairment of cognitive ability, decrease in economic productivity and reproductive performance, and the development of metabolic and cardiovascular disease. For intergenerational consequences, pregnant mothers without optimal nutritional intake will have children with suboptimal nutritional status, including impaired physical and mental development, increased likelihood for infection, and developmental delays. Now we will talk on micronutrient deficiencies in general. As we said previously, micronutrient is a term used to represent essential vitamins and minerals required from the diet to sustain all normal cellular and molecular function of the body. Micronutrient deficiencies can have a wide range of negative health impacts that will ultimately result in death if untreated. Micronutrient deficiencies are often referred to as a hidden hunger. Pregnant women and their children under 5 years of age and younger are the most vulnerable population subgroups. And this is a figure for the most important micronutrient. And as we can see, the iodine, the iron, and the vitamin A represent the most important micronutrient for the body. How we can define deficiencies of a micronutrient? First, it can be done by biomarkers. And the biomarkers is a biological features in the blood, the urine, certain tissue, or etc. that can be accurately measured and are used to investigate a normal biological process, pathogenic process, or pharmacologic response to therapeutic intervention. Biomarkers represent ideal and most standardized method for determining micronutrient deficiencies. What are limitations of biomarkers? Biomarkers are not available for all micronutrients, while other existing biomarkers are not practical or feasible for widespread assessment. Biomarkers may be influenced by inflammation, infection, hydration status, age, kidney function, and analytical method. There is a number of issues exist concerning the use of cut point for biomarkers to determine deficiencies and insufficiencies, as there is a distribution around the cutoff point. The second method that can be used for defining deficiencies is dietary intake data. These data are not routinely collected in national surveys. Database reported intakes must be region specific and are often lacking or not up to date. The third method is the functional indicators such as stunting or low birth weight. And this method is problematic because many factors contribute to these public health problems. Now we will talk on a subject called multiple micronutrient deficiencies. Single micronutrient deficiencies rarely happen in isolation. More often, multiple micronutrient deficiencies are occurring simultaneously, such as example iron, vitamin A, and zinc. Iodine may be the exception to the clustering of micronutrient deficiencies, and iodine deficiency is region specific. Deficiency in other micronutrients like selenium, iron, and vitamin A can exacerbate iodine deficiency by altering thyroid function. What are the strategies and the intervention to combat micronutrient deficiencies? First is supplementation. This includes highly concentrated vitamins and minerals produced in the form of capsules, tablets, or injections. Used when micronutrient deficiencies is severe and require a therapeutic approach to treatment. Can be used also for the prevention in certain situations. Example, vitamin A supplementation for the prevention of night blindness and infant mortality. The second strategy is food fortification, and this included addition of essential nutrients to a commonly eaten food, which is considered here as a vehicle. When there is a widespread micronutrient deficiencies, fortification is the tool with the greatest capacity to reach the most within a country. Fortification generally require policy and procedural change and engagement of the food industry. Example is the iron fortification of wheat flour and iodine fortification of salt. And the third method is dietary diversification, and this includes increasing both the quantity and the range of micronutrient-rich food consumed. Changing the dietary pattern of individuals and communities may be difficult to achieve. Dietary diversification may not be possible due to limited food availability within certain regions. Example, addition or change to complementary feeding practices when an infant starts to consume foods other than breast milk or infant formula. and thank you.